Hello, I am Dr. Clark Van Gilder, Professor of Physics at Central Arizona College. The purpose of this presentation is to explain how and why improved ventilation is a cornerstone strategy for beating COVID in our schools. Though public schools are my focus in this presentation, these solutions will work for all indoor spaces. A June 2020 study from the U.S. Government Accountability Office shows at least 41% of schools need to update or replace their ventilation systems. One update would be MERV 13 filters. They're just one of many simple solutions that the American Society of Heating, Refrigeration, and Air Conditioning Engineers, or ASHRAE, recommend. But older HVAC units, such as those typically found in public schools, simply can't handle the load. The National Council on School Facilities estimates that it would take $145 billion to upgrade schools to acceptable building standards, including the ventilation improvements. So, given that K-12 students are roughly 1/6 of the population, this is a matter of public health. Public health is undoubtedly one of the best things that government can offer to its citizens, as it seeks to protect and improve the health of all of us. Epidemiology is one of several pillars undergirding public health, as it explains the spread of disease within populations. Public health is a branch of medicine which, among other things, helps populations survive viruses by delivering ways to get them out of our cells, whereas virology seeks to explain why they got there in the first place. Engineers create systems and materials that, among other things, mitigate against viruses traveling in the air because the laws of physics so adequately describe how and why they do. Science is the foundation of practice that converges on public health. All of these disciplines make our lives better. My apologies to the branches of science that were left out for the sake of simplicity here today. Why are physics and engineering so important to public health? Well, physics explains why things move, and virus particles move in predictable ways under the laws of physics because they are transported by aerosols. Engineers just find ways to manage that with systems and materials. COVID-19, like any other respiratory virus, hitches a ride, without permission by the way, on the aerosols that humans generate by merely being alive. But this is their downfall. When heat and humidity and forces like electricity and gravity constrain the motion of particles, then that is when physics and engineering will find ways to deal with it. Some basic terms first. Natural ventilation is just letting the outdoor air in, whereas mechanical ventilation involves forcing outside air in or recirculating that inside air. HEPA filters tend to go in floor-level air purification units, whereas MERV filters tend to go in mechanical ventilation systems, or what's in the ceiling ductwork of your facility or home. Both end up purifying the air with high efficiency. More fresh air is probably the most basic definition of good ventilation. But what do you get with more fresh air? Good question. Glad you asked. Better cognition, and thus higher test scores for the test takers. The scientific literature on this is plentiful and long-standing. Research also indicates that more fresh air equates to more seat time for kids and less sick time for teachers, both of which are budgetary successes. More fresh air is therefore a win-win-win scenario. The practical advantages to the mission of education are significant and undeniable. Fixing the ventilation disaster for the sake of COVID reaps benefits that far outlast it. Better ventilation is bigger than this pandemic. But wait, there's more. Fresh air. More fresh air necessarily means less aerosols, regardless of what those aerosols are carrying. Less aerosols during a COVID-19 pandemic means less COVID-19 in the air. This is an inescapable fact of physics. HEPA air purifiers can clear a room of 90% of the aerosols therein, and proper building ventilation can reduce airborne infection attack rates by 97%. More fresh air also means less carbon dioxide, or CO2. For example, a nursing home in the Netherlands recently avoided a COVID outbreak in all but one of 7 wards because the HVAC system was configured to bring in fresh air whenever the CO2 levels hit a set point. A mask-wearing staff of over 100 stayed uninfected and about 100 patients in the other 6 wards did too. The 7th ward was simply too inactive to hit the set point for CO2, and they suffered for it due to poor ventilation. Here we have do-it-yourself and buy-it-yourself options that have been used for decades to correct aerosol problems like dust, pollen, mold, and smoke. Smoke is an aerosol. Exhaled breath is an aerosol. Aerosols are just tiny solids or liquids hanging out in the air. Aerosols generated by humans move just like smoke, except for the fact that you cannot see or smell them. With smoke, you'd either get away from the source, remove the source, or turn on a filtering device. It is physically impossible for these devices to fail at taking care of aerosols, COVID or not, unless you turn them off, sabotage them in some way, or use them beyond their capacity. A quick tutorial on particle sizes and how that relates to filtration. You've all seen a human hair, but seeing things smaller than that becomes very difficult, very quick. Dust, pollen, and mold are 5 times smaller than hair, and smoke is 20 times smaller. Though we can see clouds of things like dust or smoke, we can't see individual particles of this type without a microscope. Here again we see how various particles size up relative to one another. Smoke is smaller than a blood cell, but bigger than bacteria. COVID-19 is smaller than a bacteria, but 14 times larger than the smallest particle that a typical mass can stop. It should be noted that the virus is never naked in the environment, but rather it is bound up in a particle the size of smoke or larger. It's not even a fair fight for the virus if masks and filters are in your place and in your face. This simulation provides results that are based on the laws of physics and are consistent with direct observations. It shows how aerosol clouds progress as seen from the side and from above. The particle sizes are a bit exaggerated for clarity's sake here. Note that we emit hundreds of millions of particles per day per person, thousands per second on average. And here at half a second you can see how the aerosol cloud would look if you could see it. 1 second later, it's starting to engulf the person that is supposedly physically distanced, and then 3 seconds later, totally engulfed in that cloud, and still the same in 5 seconds. And these particles will tend to hang in the air for minutes to hours. COVID clouds. Where do they come from? Respiration and vocalization processes vibrate thin sheets of mucus that line our respiratory tracts. They immediately begin to evaporate when they exit our mouth, and this thermodynamic process is what gives them buoyancy in air and hang times of minutes to hour. While there is little difference between symptomatic and asymptomatic spreaders in terms of what they can shed in our breathing spaces, there is tremendous variance in how productive any particular person will be with aerosols. Roughly 80% of all aerosols are generated by only 20% of the people, because a small fraction of super emitters release 10 times as much as the rest. The coronavirus is what epidemiologists would call an over-dispersed pathogen, because it tends to spread in clusters where one individual, a super emitter, has the capacity to infect many others. Given that 40% of the infected are asymptomatic and that incubation takes 3 to 14 days, we must take additional measures until rapid daily testing gains sufficient traction to help us isolate the infected better than we currently are. Animal studies, air sampling, and super spreading event data show that aerosol transmission, or airborne, is one of the primary modes of infection rather than just direct contact through fomites or short-range spray droplets. All 3 routes are viable transmission routes, but aerosol transmission seems to be the most likely given the most current data. Whether small or large, these aerosols have some serious hang time in the air, and if breathed in will deposit all over the respiratory tract. If COVID is there, then infection is likely, but the severity of the disease depends on how much exposure a person receives, which is why mitigating against the source is so important. Less aerosols means less COVID, which means less infections, less sickness, and less death. Filtration and purification are essential tools in the fight against COVID-19, or for that matter, any virus, anywhere, at any time. Okay, back to the machines. Casa Grande Elementary School District recently bought 395 of these units to put in every classroom in their district. CADR, or Clean Air Delivery Rate. CADR ratings specify the unit's ability to deal with smoke, dust, or pollen. All we care about relative to COVID is the smoke catter number because that is the transport size that we need to mitigate for. There are not many units out there with a catter of 950, and what this number means is that in a 950 square foot room with 10-foot ceilings, you'll get 6 air changes per hour, or 6 ACH. 6 ACH in every room is the target for good ventilation under any circumstance. The easiest thing to remember for catter is to simply match that number with a room square footage when ceiling height is at least close to 10 feet. Behold the Corsi-Rosenthal box fan air cleaner. Say that 10 times real fast. Dr. Richard Corsi is one of the world's leading experts in indoor air quality and currently serves as a Dean of Engineering at Portland State University. Corsi suggested this design to Jim Rosenthal of Texair Filters, and the rest is history if you follow them on Twitter. The box design means more filters means more surface area, and that means more airflow with less load on the fan. The catter of this unit is 700 cubic feet per minute, depending on fan speed. MERV 13 filters are only 85% as efficient as a HEPA filter, which are 99% efficient, and they cover a smaller set of particle sizes. But these units will outperform smaller catter HEPA units due to the sheer volume of air that they move. A typical HEPA air purifier has a catter of only 200 to 300, so this box fan is going to move roughly 3 times the amount of air per minute. They don't look as nice as the commercial HEPA units, but they are beasts when it comes to moving air and filtering it. Don't let the looks deceive you on their quality. If NASA can DIY it, then so can we. Look at the highlighted items in this list. You probably have those things at home right now. If NASA can save Apollo 13 with duct tape and socks and bungee cords, then I think we can tolerate a DIY approach to indoor air quality if budget dictates. Which way is better? The easy answer is the one that you can do right now, and the harder answer is the one that matches your risk tolerance. Do something now. There are no silver bullets in this fight against COVID, and the victory obtains with a comprehensive set of solutions. Assess risk the best that you can, with the knowledge that zero risk is, and always has been, unachievable. We get to minimize risk, and that is as good as it gets. Speaking of risk assessment, given some data about your venue, its participants, and the prevalence of the disease in your region, you can use a tool like this one to quickly obtain a risk assessment probability. Now, the details of this are a bit complicated and go beyond the scope of this presentation, so let us move on to what kind of information it can deliver to you by looking back in time to one of the most well-documented super-spreading events of 2020. The Skagit Valley Choir incident involved 60 or more people in a 2,500 square foot room singing for over 2 hours with little to no ventilation, no masks, no distancing, etc. No mitigation in such a venue means almost everyone gets it, an 80% infection rate, and that's about what happened. 75% I think was the actual number. Mitigation options would include increased airflow, air purification, masks, and a shorter duration of the event, just to mention a few. Only one of those mitigations employed would have dropped that infection probability to 50%. Had they used all 4, 7%. Had they done this, then it's very likely that no one would have died. Had they taken it outside, it's almost certain that no one would have even gotten sick. This is what we're trying to do. Fake the outside environment inside when it's not feasible to go outside. By the way, 99% of all transmission events are indoors, where ventilation is poor and too many people are too close together for too long. The Swiss cheese model is merely a cute way to imagine a multi-layered approach. Social distancing, wearing masks, washing hands, rapid testing, these all protect us. The clarity on indoor air quality was not in full view until after this model was crafted, so we could add a 5th piece of cheese called indoor air quality. So what is the solution set? Let me explain. Indoor air quality is in your place and in your face. Indoor air quality in your place or in the mechanical ventilation system in your ceilings. 1. Bring more fresh air in. 2. Filter all the air that you can, especially the recirculated air. 3. Measure CO2 and keep it under 800 parts per million by increased ventilation. 4. Consider UVC lighting wherever possible. UVC kills the virus in seconds. Know that you need to hire professionals to install such things, whether in the ductwork or in high ceiling reliefs where you could install UVC lights. It's not something you just go down to Home Depot and do yourself. Yes, there is a journal, one of many, devoted to indoor air quality. Physicists, chemists, and engineers have been studying this for decades. The IAQ solution, indoor air quality, to our present problem has been a known quantity since the 20th century. When we put MERV and HVAC systems together, it reduced costs through increased productivity resulting from a healthier work habitat. It is a well-studied thing. Spending some money on indoor air quality results in saving a bunch more money. It is as much a good public health decision as it is a good business decision. Indoor air quality in your face, or floor-level mitigation and air purification. Wear masks. 2 people face-to-face with average masks means 75% less aerosols in their face. 2. Distance works well for big droplets, but not for aerosols, so we really need more than 6 feet. Number 3. HEPA filters are 99% efficient for all relevant particle sizes and even some of the irrelevant ones. Take your face for an hourly walk. Intermittent occupancy lets the ventilation system catch up. So, take a walk, please. Taking your face for a walk is even a matter of scientific inquiry. 1 10-minute break per hour, or longer, if everyone leaves the room, has a tremendous impact on aerosol reduction if ventilation and/or air purification systems are configured properly. Source control isn't limited to masks only. The emitters behind those masks can remove themselves from the indoor habitat where most transmission events occur. What to expect with better indoor air quality? More seat time in schools and at work because more students or employees are not sick. Therefore, less sick time for the same reason. Better air quality means better health, period. You will feel better and perform better if your air is cleaner. I don't think anyone needs to go to college to figure that one out. Finally, indoor air quality provides a dead-end street for many disease vectors, including COVID. Roughly 10,000 K-12 kids go to school in Casa Grande, where I live, which has a population of roughly 60,000. What do you think the impact will be when 1/6 of a population spends 1/3 of their day with 90% or more less exposure to COVID-19? These solutions will not stop community spread, but they should slow it down in a measurable and significant way. In this way, physics and engineering underwrites the check that public health can take to the bank. What I've shown you here today works anywhere that is defined as inside. It'll work in your office, in your house, in our prisons, and as I've explained here today, in our schools. Inside is where nearly all transmission events occur, and thus inside is where the indoor air quality fight must be fought. With that, I conclude my presentation. Feel free to contact me with any questions at any time. I'm glad to help whoever I can, wherever and whenever I can. Thank you for your time and consideration.